Just a short discussion on autoimmunity. This is section 16.6. Some of the autoimmune diseases, what causes them? That's a big question. And what is actually happening with an autoimmune disease? So an individual develops hypersensitivity to himself or herself, and you have these autoantibodies, T cells, in some case both, that mount an abnormal attack against self cells. So you have systemic kinds that involve major organs and flow through the whole system, and organ-specific ones that only involve one organ or one tissue. And I'm going to have you identify what organ in the cases where they're not systemic. So more than about 80 recognized autoimmune diseases, and they affect around 23 million Americans. So it is very likely that someone you know has an autoimmune disease. So this is a list, and you can see the two that are systemic. I would say this is also just joints. So if I say rheumatoid arthritis, then the tissue that is targeted is the joints, but the joints are all over the body, so that's why they call it systemic. Graves' disease is a thyroid. It attacks the thyroid. Myasthenia gravis, it attacks the muscle, but specifically the acetylcholine receptors at the neuromuscular junction. Type 1 diabetes is the pancreas are attacked by T cells, and so that's actually an odd one, which is type 4. And then multiple sclerosis, that attacks the myelin sheath of nerve cells. So those are ones that I will have in the test, and they will be ones that you will be asked to match the target with the disease. And again, these are not immunocompromised. They're not hyposensitivities where you're immunocompromised. They are overreactions where they're attacking self cells. So that's mainly it. I'm really not going to ask you the type of hypersensitivity, whether it's 1, 2, 3, or 4, because some of these things have been changing over the years, and I'm more concerned that you understand like what the organ is, what's the target organ of this particular disease. So genetic and gender correlation, and again, correlation does not mean causation, but it seems that women account for 75% of the cases diagnosed autoimmune disease. So their biological basis remains a mystery, but they do link some autoimmunities to the X chromosome. So the role of X chromosome inactivation in the development of diseases. And so one of the chromosomes in your body, if you're female, you have an XX chromosome, and one of those chromosomes in every cell is one of the X chromosomes is inactivated, so that you don't have too much expression of the chromosome, of the genes in the chromosome. And immune systems of women who respond more robustly to antigens, which may have evolved as a strategy to protect against or to protect developing fetuses. So it may be something that resulted as a result of X chromosome inactivation. Anyway, that is one theory about how this has occurred, these autoimmune diseases that are linked to females, and females mainly have them. So why that is, we just really are still not sure, and I don't know that that is a firm idea. Again, there's this gender correlation, but not causation. Molecular mimicry, there could be molecular microbial antigens that display molecular markers that are similar to human cells, and so when they react to the microbial antigen, they produce antibodies that cross-react with normal tissues. So this is true in rheumatic fever and psoriasis, so it's the result of some sort of bacterial infection. Type 1 diabetes and MS, probably triggered by a viral infection, and it's just now attacking those antigens on those tissues. So the gut microbiome has been implicated to a lot of things, and this is one. The composition of our gut microbiome has changed over the last 50 years due to antibiotic use, less exposure to the outdoors, an altered, more artificial diet. and studies exploring the idea that a healthy microbiome is important to training our immune system, which we talked about with the hygiene theory of the type 1 hypersensitivities. So it knows what to react to and what to tolerate, and so it doesn't know which things are, foreign and which things are not. And it just doesn't know what to do with it, so it overreacts. And so the drastic changes in the microbiome would disrupt the training process. So one of the more common of these autoimmune diseases is lupus. Systemic lupus erythematosus is the SLE is the name. And so one of the things you can see with this is a bright butterfly-shaped rash on the cheeks. And the patients produce autoantibodies against a variety of organs and tissues, so it's all over the body. Kidney failure, blood abnormalities, lung inflammation, myocarditis, and skin lesions. So systemic autoimmunities, rheumatoid arthritis is considered a systemic autoimmunity because it causes progressive damage to the joints, but also in some patients it goes to the lungs, the skin, the eyes, nervous system. And the autoantibodies, basically, these are the type 3 where the antibodies bind to the antigens and they settle into the various parts of the body. They settle into the joints, and that activates the phagocytes that stimulate and release cytokines that cause the damage. If they settle into the lungs, they cause damage there. If they settle into the skin, they cause damage there. If they settle in the eyes or the nervous system, those can be affected as well. So it's not just at the joints. Rheumatoid arthritis can affect all these different systems, but it causes the damage, and then in the healing process, the bones fuse together, and that's what you're seeing on this X-ray. So another autoimmunity that's caused by endocrine glands is Graves' disease, and this is where you have antibodies against the receptors for the thyroxine-secreting follicle cells of the thyroid gland, and it makes it so that you have an overproduction. It's like stimulating these cells to continue to produce thyroxine, which causes hyperthyroidism, and so you have this ramped up immune response, or not immune response, but metabolism, and the metabolism just goes out of control, and it eventually burns itself out, and it has something like what you see with type 2 diabetes. You have thyroxine resistant cells, and so then that's kind of part of it. So it seems like, woo, that's a great thing to have if you're trying to lose weight, but then once you burn out your metabolism, then it's like you don't have any metabolism, and you have all other kinds of problems like thyroid eye disease or TED, where they try to close their eyelids and they can't because of this bulging that happens. So another is type 1 diabetes. This affects the pancreas that produces insulin, and it regulates glucose utilization by the cells. So the beta cells of the pancreas produce the insulin, and they think this is molecular mimicry. Could be also an inappropriate immune response that leads to the lysis of the pancreatic cells. So it could be type 2 or 3. But anyway, the molecular mimicry will cause the cytotoxic T cells to damage it. So it's a type 4. And the inappropriate immune response causing the lysis of the pancreatic cells would be type 2. So type 2 and type 4 hypersensitivities with this. But it damages the cells that produce insulin, and so then you don't produce the insulin anymore. And a neuromuscular autoimmunity would be myasthenia gravis, where it attacks the acetylcholine receptors that are receiving the signal from the nerve to cause the muscle to contract. And so it damages the cell membrane so severely that transmission is blocked, and you get paralysis as a result. So the first effects are felt in the muscles of the eye and the throat, and it progresses to the skeletal muscle function and death. If it affects, like, say, the diaphragm, then you could stop breathing. So this is a serious autoimmune disease in the prognosis for this is that they don't live very long and don't make it out of their teenage years typically without treatment. Multiple sclerosis, they attack, again, this is a neuromuscular autoimmunity, they attack the myelin sheath. The myelin sheath is necessary for rapid impulses to be sent through the muscles, so that's called saltatory conduction, and it results in muscular weakness and tremors and difficulty with speech and vision and some degrees of paralysis. Concept check 16.6. Here are the questions. One of the most severe chronic autoimmune diseases is there's 3 blanks, so systemic lupus erythematosus, I believe. It affects all of the different organs of the body. It's very blank is an autoimmune disease that attacks the joints. That would be rheumatoid arthritis. Thyroid gland is affected in blank. That's called Graves' disease. Cytotoxic T cells attack insulin-producing beta cells in the pancreas, causing blank. That would be type 1 diabetes. In myasthenia gravis, the autoantibodies bind to receptors for blank, and that would be acetylcholine. And 6, in multiple sclerosis, the autoantibodies attack the blank, which surrounds the nerve cells. And that would be the myelin sheath. So that's the end of section 6.